health service saying that they are expecting more in. The nurses have issued a statement saying they don't even have the basic ones like the nose cover and the gloves. Do you have enough now?
Well, truth be told, at this point, because we also have cases that we are managing, we have started more or less running down the numbers that we have as a country.
The PPEs?
Yes.
Can it be reused though? That's a question.
No, you cannot reuse. You cannot reuse.
Oh, you can't?
No.
So all that protective clothing that you wear from head to toe, once you use it once, you remove it and that's it?
Yes, basically that's it.
Oh,
goodness. Let me take you through a simple process, how it works. Before, take that you are in the treatment room where you are going to manage a patient. It is designed in a certain way. So there's an area where you dress up. There's an area where you prepare whatever you're going to do. And when you go right into the room where the patient is, you need to spend as little time as possible with the patient.
Why?
Because the more time you spend, the higher the chances that you also get contaminated.
Even with your PPE?
Yes. And the PPEs themselves, by the time we finish, you understand why. The PPE themselves are also very hot and a bit uncomfortable as well.
Okay.
But that is not even the major thing. But the whole idea is you try to reduce the contact time as much as possible in order not to get infected. Now, before you go in, you have to plan exactly what you are going to do for the patient, exactly what, where, how, and what you are going to do. So you go in and you go and do the specifics, and quickly you are out. Now, when you go out, we take you through a specific pathway. You go into an area where you are going to get decontaminated.
What's that?
The decontamination is that we assume or we presume that you've gone in, you may have been contaminated. You don't have to come out and contaminate others. So in your full PPE, your boots, everything, we have what we use to decontaminate. Most of it contains chlorine and all that. So it was actually going to be sprayed on you completely. There's also a way of taking off your gloves and your PPE and all that. And the moment all of it is out, including your boots, which will be soaked in chlorine, everything is damped, and that is it. You don't go back to work.
Wow.
Yes. And then we've catered it such that you will take certain steps to decontaminate even the boots that you are wearing before it is off your legs completely. So you enter from one end and you exit from one end. You don't go back the same way you came in.
Goodness me.
Yes. And in a day, depending on the severity of the case, you may have to go and see this patient maybe 6-10 times. It all depends on the severity. So if the patient needs a lot more attention, then anytime you go, it means the PPE is being used. It's a one-off thing. Mind you, it is not only the doctor. You have nursing staff, you have probably people who will come and take samples for lab. Because when you are in there, we do all kinds of things. So it's just like managing a non-COVID patient who is on admission. You take your samples and all the things that you do. So if, let's say, you have a team of, say, a doctor, say 2 or 3 nurses, or 2 doctors, 2 or 3 nurses, plus some lab person, and then, let's say, oddlies who may come in once in a while to do some cleaning and what have you, you could have a situation where at each particular go, you could have between 2 to about 6, 7, 8 of the PPEs being used just on one patient. So if you go in 6 times and you say you use 6 at a go for all the entirety of the people you have, so 6 times is like 36. It's gone. So managing a case is completely different from the protocols that were being run whilst we were preparing. Okay. So we are at a point where consumption has actually gone up.
Okay.
And then because you also have cases within the country, what it means is that you take a presumptive position that there's been contact with the community. So potentially there could be other cases out there. And that is why we are doing the contact tracing and what have you. So once you take that presumptive position, then it means that the cases can also end up anywhere within the country.
Yeah.
And what that means is that the frontline health staff or the health professionals within that region, that district, should be ready to be able to handle any case that could appear anywhere. Mind you, the infection could have happened here in Accra, but the person could travel to his village or another town to do business and then he falls sick. So it is not that simple. So we are in the phase where we need the critical logistics.
Okay, and obviously we don't have enough.
We don't have enough.
I mean, the truth though is, all over the world, nobody has enough.
Nobody has enough.
Even the US has found it difficult.
Even
to
China
do common
struggled
testing
at some point because
you know,
they were the people who were hardest hit. But in terms of medical consumables, they produce virtually the largest as far as the world is concerned. But they were still struggling. Yeah, so in our case, the unfortunate thing is that we are at a point where a large majority of the world now has the disease in their environment. So everybody needs the same resources.
Yeah.
And we don't manufacture them, unfortunately.
Goodness.
So we'll have to find ways of importing them. But thankfully, the WHO, the Africa CDC, and all that are also helping to get some of these things for us. And sometimes at the WHO, once they know you have a case, even though the resources are limited, they do their best to also make some available to you because you really need them as compared to somebody who is here to get a case. So it's a very dicey situation.
It is.
And we'll have to manage. But in terms of the resources, we need to do our best to make sure that we have them at the facility level because the healthcare personnel, the frontline people, if they don't feel protected, then all the stories that you've heard around will be happening because you hear, oh, they were not there. Because nobody will want to walk into danger. Even our laws as a country does not permit that. The labor law is so clear that as a worker, if you find that you are in danger by way of your working environment, you have to walk away.